everyone. It's good to be with you today. So I'm Bobbie Boyer, and for most of the last 5 years, I've had the privilege of serving as Deputy Director with the Office of Prevention Services at Ohio Department of Mental Health and Addiction Services, and as the NPN for Ohio. In the last couple of weeks, I've moved over to the policy section. Okay, let me go. Oh, thank you. Is that better? Okay, good. All right. The last couple of weeks, I moved over to the policy section of our department to make room for our new director's new appointment to our area. So I have some of my team, of my previous team, that I still consider my team with me today, and I would like them to show themselves to you. So I've got Molly Stone, who was our prior NPN before me, and Dr. Dawn Thomas, and Shemaine Armour, yes, and James Tigrino. I thought he was here. Yeah. And I don't know if Jeannie's with us in the room or not, but she's here. Jeannie Harrison is another one of our team on that thing. So each of them are very knowledgeable about the work of the team. So you can call on them afterwards if you have questions about any strategies that we're hearing about today. Feel free to reach out to them. Okay, at the beginning of my time with this team, we spent a lot of time developing a strategic plan and to guide our work. And so when we wrote the plan, put it all together, I decided that we needed to put as much information in there to help people understand the foundation of why we do what we do. So in that plan, we wrote our foundational pieces. It has our theory of change or our logic model in there. And it shows our alignment with the National Academy of Sciences 2019 report with the language and things like that. We also included our evidence-based frameworks in the back. So, and these are the strategic priorities of our plan, and so you can see those there. But basically, all of our work is centered around our partnerships, and this work is the same. During COVID, we received additional federal dollars to support prevention, thanks to SAMHSA's requirement of 20% set aside for prevention. Thank you. When we spent those dollars, we thought long and hard about how we can use those dollars to invest in infrastructure that could be sustained for local communities. And one of those investments was for the Ohio Center of Excellence for Behavioral Health Prevention and Promotion at Ohio University's Voinovich School of Leadership and Public Service. The OU team, led by Dr. Holly Raffle, has been a partner for many years, helping us to lead and develop so many of our strategies, including our student surveys, coalition development, children incarcerated parents, and youth-led, just to name a few. It was a logical next step for them to win the competitive bid for the COE. Now on today's topic of DEI. I just want to put it out there that sometimes DEI has become a little controversial. And there's, over the years, we have to change our language a bit. But the work still goes on, especially in prevention. It's central to everything we do, our cultural competency work. And I really think that Ohio's doing a bang-up job of that, and I wanted to tell our story with you today. So I asked Holly to help me do that. Holly's been central to all this work, and she'll be able to give some great examples of how we've applied cultural competency to our work. So we've worked at increasing the diversity of the workforce, and we've worked with social determinants of health, and we've been working to increase involvement and participation from our high-risk populations. So without further ado, I'd like to have you welcome Dr. Holly Raffle.
Thank you so much, Bobbie. It's a pleasure to be up here representing Ohio. And before I get started, I want to say that I'm really the vessel here that's describing to you work of many partners across many initiatives. So I don't want you for a minute to think that all of this work is attributable to me. I'm just the one who is fortunate enough today to be up here to share Ohio's story. That being said, I always think it's good to give folks a minute to see a little bit about the person who's presenting. You can see with my family's consent, our most recent family photo that we take. This picture was taken up on what we call the Ridges at Ohio University. And the Ridges was the site of one of the first institutions of mental health, which they called the insane asylum back then. What you're seeing behind is a pond that was dug. And if you look just to my older son, if you look to his left, and he's the one on your far left, if you look up, what you'll see is a hill with a series of unmarked graves. And those graves were places where they buried the patients that were at that institution. And I think it's special that that's where my office is located, because it reminds me of how far we've come and how much prevention has played a role in us moving forward. So I couldn't be prouder to stand here today where I got my start at Glen Estee High School, participating in youth-led prevention, although back then they called it peer counseling. And then we realized it probably isn't a good idea to call people counselors who are in middle school and high school. And then prevention led me back to this amazing career, and I'm so happy to be here today. For many of you, you have a little card there with links to today's content. If you didn't get a card, you can go ahead and scan this QR code. What will open up is a link tree, and all of the videos and all of the links that you're going to see here today are available on that link tree. Of course, I had nothing to do with making the card or the link tree, so the wonderful staff that I have the privilege of leading, they're amazing, and they did that for me. So let's get started. We have 3 key learning objectives here today, and most importantly, what we want to talk about is how that middle part of the strategic prevention framework, and now that outer circle that we're most recently adding of cultural competence and equity, are so important right from the very beginning of thinking about programming and how your program evolves along the way. So starting at the beginning, and I really think I need to pause here and set the stage. As the Center of Excellence, one of our first directives was to utilize SAMHSA's Disparities Impact Statement process to guide our infrastructure development. And that DIS, as they call it, for Disparities Impact Statement, was crucial into helping us realize that this work must go on and it needs to be codified, and this is an outward sign that we believe that what we are doing is necessary and the right thing to do for Ohioans. You can find that Disparities Impact Statement on our link tree, so you can take a minute and read through that. It was done by a committee of folks who are our founding partners of the Center of Excellence, so our nonprofit entities, representative from higher education. They came together, reviewed the data, right? And then they said, hey, let's create some priorities, which were then voted upon by the entire group. So what did our data tell us? Well, right off the bat, it told us that for over 11 million Ohioans, we have 645 credentialed provincial specialists, right? So we know we don't have enough. And so we know that we need to increase the prevention workforce, but when you increase the prevention workforce, you also must be mindful that you're increasing the prevention workforce in a way where Ohioans can see themselves in the prevention specialists that are going to be serving them. And so when you talk about diversity, equity, inclusion, and justice, it comes from the very beginning, right? Because we could have looked at these numbers and said, we don't have enough prevention specialists and we just need more. But what we did instead is we looked at the cross tabulations, and that's part of the DIS, so you can see that data in depth, and said, you know what, we really need more men. We need more representation of the BIPOC community, and we need to think strategically about how we are going to increase the number of prevention specialists in a way that reduces health inequities. So, how do you do that? And this is our learning objective number 1. How do we have strategies implemented that are going to increase the diversity of the prevention workforce? And I have the privilege of talking today about 2 initiatives. One, the BIPOC Prevention Skills Training, and we have several people here on that team, so please stand up back in the back. Thank you so much. And then we also have our class standards as a catalyst for prevention, which was a learning collaborative. So we'll start by growing the Ohio's prevention workforce with an intentional focus on diversity, equity, inclusion, and justice. And before I move forward, I want you to notice all of the partners that it took. It cannot be done alone, right? We have to work together as a prevention community in order to get to where we want and where we need to be. And we heard that this morning. No single entity or agency can do this work alone. And these slides have come from this group as a collective. And again, I am just privileged here today to be able to represent them to you. The goal of this particular project was to create a prevention skills training, or PST, that was designed by the BIPOC community for the BIPOC community, that maintained the prevention skills training known as SAPS to fidelity, but also included things like historical trauma, included things like collective trauma, included things like healing circles, right? It's a truly culturally centered approach to prevention skills training. In Ohio, we have a credentialing process. So if you engage in this training, you get 40 and a half of the 45 required hours to get you to the prevention specialist assistant. We also work collaboratively with Ohio's Coaching and Mentoring Network, also known as OCAM, that started with our SPIF PFS discretionary grant that the state was awarded. And this has continued over the years. And what it does is it allows people to work towards their certification in a supported manner. So huge shout out to the team. They have implemented 5 cohorts of the BIPOC PST, and we have trained 57 individuals so far in our pilot year. We have one of our master trainers, I can see Dr. Marquita Robinson back there, and Albert, did Albert make it in today? Stand up to our master trainers back there. Thank you very much for being here today. As Albert likes to say, the BIPOC supplemental sessions was bridge work. Again, none of the content of the training formerly known as SAPS, as from back in the day, was altered. This is the training done to fidelity. You get the concepts, you get the research, and you get case studies. What our BIPOC supplemental sessions do is they bring in unique cultural experiences. It allows for discovery and how these experiences impact and imprint upon us in our decision making as we move through this journey called life, right? And we've had people who take the BIPOC PST who say, oh my goodness, I never realized what historical trauma, what collective trauma meant, not only for me, but for the community, and for how we need to tweak our prevention programming in order to account for that. There were several pedagogical innovations that this amazing team did. One is it is an affinity group model. It is by BIPOC individuals for BIPOC individuals, and even the name BIPOC was researched, right? This team sent out a survey and said, what should we call this prevention skills training? And they offered several choices. And individuals said, we want it to be called the BIPOC PST, involving the community even in naming the project means that you're putting diversity, equity, inclusion in from the very beginning. In the second pedagogical innovation was journaling and healing circles. So journaling, allowing people to process a training, process what they're hearing about social determinants of health, how it impacted them as individuals, how being trauma-informed is necessary and what that means, right? And then at the end of the day, closing each day of the training with a healing circle. Because when you talk about those issues, right, it stirs up emotions and feelings in ways that need to be dealt with in a healing manner. So the healing circles have been a real source of strength for this training. And then, of course, our third, the coaching, right? It's not just about the training, but it's about getting folks to that next step of certification in a supported environment. And that's where our folks at the Ohio Coaching and Mentoring Network come in. And we have our certification steps here in Ohio. And what the BIPOC PST does is they have a coach who is specifically from the BIPOC population for that particular population, who schedules individual meetings, talks to people about their certification options, and if certification is right for them, helps support them through that process, even up into practice testing for the ICRC prevention examination. This was how the project was originally planned, and of course, things happen along the way, and what has happened is we had one member of the BIPOC PST who said, we need to stay together. And the BIPOC PST alumni group was born. And so we have BIPOC PST alumni groups who meet as a learning community, and they have supported online and virtual environments. So online they use connectivity space, which brings folks together in like a chat board, and then they have that face-to-face interaction over Zoom. And I'm excited to see after this pilot where this project goes. Our next initiative is using the culturally and linguistically appropriate services standards as a catalyst for prevention. If we want to have a diverse prevention workforce, our agencies need to be viewed as places that are safe to work, right? So we have a lot of work to do at our agencies in order to have a home for folks when they are certified and working in the field. This project was really special because, as you see, it is a demonstration of local, a statewide, nonprofit. The PTTC came in, so we have federal involvement. We have the university that I'm a part of, actually worked separately from the Center of Excellence, and of course our partners from the Mental Health and Addiction Services Department. This work cannot be done alone. What this work did was it utilized the class standards and the NIATEX model to bring people together to learn what the class standards are, how they relate to prevention, and then identify a project so they actually got to practice putting the class standards in action. And in Ohio, we do a lot of learning communities because what we know is that training is not enough. You actually, as an adult learner, an adult learning style, you sit in a training and what do you retain, right? You retain a couple of good ideas, but if you have to go live it and work with it for months and months and months, then you adopt that into your practice. So communities were actually funded small stipends to come and engage in this class standards work. The process looked a lot like this. They had a 2-day face-to-face summit where our trainers from the PTTC came in and trained on the class standards, the NIATEX model, and level set. Then, over time, they had 3 coaching sessions with each of the grantees. The grantees worked with their trainers to refine their plans and then implement them. And then at the end, we had a celebration event. So if you were a participant, this is what it looked like for you. You were walked through a process where you formed a change management team. You conducted a class assessment of your organization. Then from that assessment, there's that data, you set up a project. After you set up the project, you implemented it, and then you went through evaluation and celebration. All of the projects are on that link tree, so you can see what all the projects were, and you can see their PowerPoints that they presented and celebrated at our celebration event. Again, you have to fully commit and go all in on DEI, right? And it's more than training, it's about creating environments for people to actually practice and use the material. All right, we made it through learning objective number 1. So setting the stage for learning objectives number 2 and 3. What we know is that evidence-based programs, policies, and practice designed for behavioral health prevention and promotion will not eliminate health disparities and inequities, period. They will not if you do them alone. So let's explore why. How many of you are familiar with the social determinants of health? Yes, those are all of those things that influence our actions, our attitudes, our behaviors. One thing that we'd like you to impart or take away with you today is that social determinants of health in and of themselves aren't good or bad. They're value neutral. They are experiences. I've been in meetings before where people will say, oh, we have this negative outcome. Oh, that's social determinants of health. Social determinants of health are risk and protective factors. So when you're looking at social determinants of health in the community, it's so important to capitalize on the protective factors and ameliorate the risks, right? So social determinants of health are value neutral. And we have to learn how to take those risk and protective factors and make them a part of the programming that we do. Social determinants of health, though, are a small part of our experiences. You can't talk about social determinants of health if you're not willing to talk about structural determinants of health. So we have a lot of isms: racism, sexism, cisgenderism, and the list could go on, right? And what we know is that social determinants of health are a product of those social structural determinants of health. And if we're not willing to address those structures along with the social determinants of health, we're not going to see the progress that we want to make. And I'm going to pause here to talk a little bit about stigma and stigma's relationship to ableism, right? We look at stigma, and again, that's a word that we say, oh, we got that outcome because of stigma. But let's unpack what that stigma is saying. What we're saying is we got that outcome because those individuals are experiencing something that makes them feel or look as less than, because there's a power inequity there. So whatever the stigma is, it's important to remember that stigma is an ism, and it's baked into structural determinants of health, which can then impact social determinants of health. So it's really a different way of thinking about what stigma is. We like to say end the stigma or stop the stigma. It would be the same thing as saying end racism or end sexism or end cisgenderism. The work needs to be much, much deeper than that. And I'll pause here for a little bit to talk about health disparities and health inequities. Health disparities are population-based differences. Health inequities, sometimes we can expect. Boy babies are typically born larger than girl babies, and that is just based upon biology. And that is a disparity, right? But not all disparities are inequities. Inequities are when something could be avoidable. And we see that in the link between the stress of racism experienced by Black women and the negative health outcomes in Black women and Black children. Right? That is an inequity. That is something that could be addressed. So our evidence-based programs, policies, and practices and our SAMHSA guidelines tell us this. They are designed, right, to do a specific outcome, whether it's reduce alcohol use or increase parental conversations about alcohol. They aren't designed to address structural determinants of health or social determinants of health. And it's important to know that our EBPs alone need something a little extra, because in the real world, we know that our health behaviors are influenced by quite a bit, right? 40% of them by socioeconomic factors, 40%. So when we look together as our structural and social determinants of health, I'll ask you this: where do we prioritize our efforts? Addressing the behavioral health issues or addressing the health disparities and inequities? What do we need to do? Raise your hand if you say addressing the behavioral health issues. Raise your hand if you say addressing the health disparities and inequities. Raise your hand if you really wish I would have told you both. Absolutely. This is where we have to recognize that two things can be true. right? If we're a coalition and we're addressing behavioral health, we also must keep our eye on the social and structural determinants of health as well. It is so important to prioritize both, looking for that and. Which leads us to our learning objective number 2. Prevention has an amazing, amazing role in addressing social determinants of health, because addressing social determinants of health requires community-driven solutions. And I don't know anybody better at addressing community-driven solutions than preventionists and the coalitions that serve communities, right? We already know how to do that. The next Ohio initiative that I'd like to share with you is Ohio's Community Collective Impact Model for Change. This was also funded by SAMHSA's work, and those discretionary dollars that came down with COVID. So we engaged 5 urban boards, and what we wanted them to do is utilize the CDC resource, Promoting Health Equity, a resource to help communities address social determinants of health. The whole goal of this project was to get us to move from downstream and midstream to upstream, right? We know what downstream is providing that care, those treatments. And we get to midstream, and that's meeting people's needs and meeting them where they're at. But we wanted to go further up, right? And we wanted to improve those community conditions, those social determinants of health. So we have our 5 behavioral health boards, and what we like to call this initiative is the SPIF and, right? The Strategic Prevention Framework is an amazing framework to work, and it also needs some specificity. So with this work on social determinants of health, I invite you all to use your skills in working the Strategic Prevention Framework and pair it with the CDC guidebook, because when you do, amazing things can happen.
In fiscal year 2021, through the Substance Abuse Prevention and Treatment Block Grant Program COVID-19 Supplemental Awards, the Ohio Department of Mental Health and Addiction Services, Ohio University's Voinovich School of Leadership and Public Service, and the Pacific Institute for Research and Evaluation came together to provide support to 5 urban behavioral health boards in Ohio as they engaged in community-based processes to address the impact of social determinants of health when planning for substance use disorder prevention and mental health promotion services and programming. This Community Collective Impact Model for Change 2.0, addressing social determinants of health in minority and underserved communities, was unique because the urban behavioral health boards received phased funding. Project directors began Phase 1 by working to bring together people and groups who had lived experience with health disparities and social determinants of health. Collaboratively and iteratively, community work groups created a data-driven impact statement in Phase 2. From this impact statement, work groups then created 3-year prevention services plans, detailing the goals, objectives, and action steps to be taken to address a specific social determinant of health within an identified priority population as the final initiative phase. The series of videos that follow were created by the communities for the communities and highlight the 3 phases of this initiative through photo voice, ethical photography for social change.
So the Montgomery County Alcohol, Drug Addiction, and Mental Health Services Board, ADAMHS, has convened a fluid work group, the Health Equity Steering Committee, with the purpose of guiding strategic planning and priorities and work plans through a lens of diversity, equity, and inclusion. This group comes together to identify resources, provide a whole community perspective in facilitating building comprehensive strategic plans to address the various social determinants of health, from micro factors that are downstream moving towards midstream, all the way up to macro factors that are upstream level. These pieces of information are then utilized to inform planning and an equitable allocation of resources. This was done through our community conversations hosted by Dayton Food Bank and through training provided by ADAMHS in mental health first aid to the food bank staff.
So here at the food bank, we are the Food Bank Inc., and we are located in Montgomery County. We service 2.5 counties, Montgomery, Greene, and Preble counties of Ohio. But our base warehouse is located in the 45417 zip code. This is a zip code that has been historically marginalized and disinvested in for many years. And we chose purposely to build here because we wanted to create a space where we would be accessible to the community, and we just really chose to invest into this area where there had been so many years of disinvestment.
Food insecurity, really is just, to me, a lack of consistent food. I feel strongly about the word consistent in this, just because it seems like, you can maybe get food, one time, during a week, 1 week of the month, and then the rest of the month you're kind of struggling till, to get to the next month. So I feel like consistency is a big word in that. Obviously there's a lot of access as well, but I think lack of consistent food is a big deal there.
So it's important for people to come together to address food security for many reasons, because we can't do it by ourselves. One of our mottos here at the food bank is that we're not a food bank without our member agencies. So we can't solve everything by ourselves, and so we have 100+ member agencies throughout the community who are food pantries, homeless shelters, kids cafes, and that's one avenue of the path to solving hunger, right? So that's like the immediate need. We're getting our agencies the food that then people can get from them to get the food they need. But we're not the only people we are not going to be the people who solve hunger in Dayton. We're going to be part of it, and we need the community to do that. We need our neighbors who are in food insecurity to express what they need from us. We need people to volunteer, we need people to donate. We need organizations to help partner with us. And there's so many other issues that are tackled with hunger, racism, systemic racism, poverty, mental health issues. And there's already a lot of nonprofits doing that, and we can't solve any of those issues if we don't do it as a community.
The Self-Care Committee volunteered at the food bank to plant and serve flowers and other fruits and vegetables within the greenhouse space. They did this, 1, to share the knowledge about how to do these activities, and 2, to be able to enhance awareness of resources to providers that work in our community. Coming together and have a collective impact not only ensures that we are able to bring sustainable change into our community, but also impact intergenerational trauma.
Mahoning County SDOH Grant Impact Statement. As we address social determinants of health, Mahoning County recognizes the need in underserved communities to reduce stigmas surrounding availability and access to healthcare services, including mental health services, by providing resource fairs, trainings, and an anti-stigma campaign initiative. Take that step. We will help individuals in our underserved populations understand that resources are available and accessible, enhancing the upstream social environments in healthcare, education, and social services.
All right? We will help individuals in our underserved populations understand that resources are available. I am the Community Engagement and Outreach Coordinator for the Lake County Mental Health and Recovery Board. That is my title. I love doing this work because I just want to help people. We do this day in, day out, and you do it, right? To just help people and impact change. I'm a project director and goalie status of Office of Authority Health. For Youngstown City Health District. She is the other project director for this grant. What happens is like when we are out at, we do a lot of resource fairs, community events to make sure that people understand what help is available. And so everywhere we've gone, every event that we've participated in, people come up to us and say, either I didn't know this was available, or they'll say, I really need this help. Thank you, for sharing these resources with us. Or we'll have to, make sure they know, okay, I know that there's help available, but you have to take that step, to access those resources. This is our work group, okay? So we have Joseph Oka, Elizabeth, Jamil, they're from Youngstown City Health District. And I have to work with my partner, Mr. Bernie from SIR, the Community Initiative to Reduce Violence. Okay, we're This is our work group for our grant, and we've been working hard. So like everywhere we went, and that's how we developed our prevention services plan. That's how we developed, the Take That Step campaign, because our whole messaging is to the people that in our communities that we serve, and the individuals in the community, and it expands. It doesn't mean, I know our grant targeted underserved and minority populations, but at the same time, everybody can benefit taking that step. Everybody in whatever capacity you need help, it expands across all, racial backgrounds, cultural, financial background, doesn't matter. If people need help, they need help.
Two of the most important documents that exist in any county, and really not only just in the state of Ohio, but throughout this country, are the Community Health Assessment and the Community Health Improvement Plan. And in those, it's where it's your voice that tells us what's wrong and what's happening in the community. And what was clear is that the reason that we're having these disparities that exist when it comes to healthcare, when it comes to schools, when it comes to our community context, is because of the social determinants of health. The 5 spokes of a wheel that help a community thrive. And that is when you have good schools, you have good jobs, you have that community context, a place that you can go and actually communicate with other people, that you have good neighborhoods and housing, and that you have good hospitals. And those 5 spokes are a necessity for a community to thrive.
I think for us in creating our impact statement, it was important for us to be inclusive, but also to address what we really needed to focus on. I want to share our impact statement with you because I think it speaks to where our community is going long term. Our focus is to create a community of practice by increasing the understanding of social determinants of health in relationship to mental health and substance use disorder, and to increase the local capacity to bring stability and more specific services to address health inequities among underserved and marginalized communities in Lorain County. That particular statement is almost like an umbrella to bring everybody up under us so that we can continue to do our work effectively together. So I think it's very important that an impact statement does that. And what we found in our community, it has done that for us. It took us a while to get to that point to develop an impact statement, but I think it's very critical for communities to do that.
The Social Determinants of Health Impact Statement clearly outlines the urgency of addressing these determinants and issues a call to action. It inspires community members to get involved and advocate for change. It also stresses the importance of partnership between community, organizations, healthcare providers, local government, and other stakeholders in tackling social determinants of health. This can engage collaboration and coordination among various entities.
Well, one of the ways that this community group got together was having this conference that we had in August.
During the summit, we had breakout sessions, and we were able to write out on these templates the work that each organizational partner at that table was doing and how that work overlapped. And we were able to start having great dialogue on how we can connect the different pieces and parts at different organizations in order to all be moving in the same direction to address the certain topic of social determinants of health, and really be able to figure out how we can work more collectively together at different organizations to be able to move the needle.
I think that there is power in numbers, and I feel like when we are trying to tackle a large issue such as social determinants of health, it's a systemic issue, and we know that there are power in numbers. We know that people want to have their voice heard, and that the more people involved in this effort, the more that the community can become aware of what it is that needs to be changed. Thank you.
So Hamilton County is a large community, it's very diverse. We are very research rich in terms of different things that fall under social determinants of health. We have a healthcare system that's huge, and a number of the hospitals are just world known. We have Fortune 500 companies that reflect economic stability. We have, a number of neighborhoods who have great parks. So we just have many resources here. Everyone doesn't have access to it. And because they don't have access to it, the outcomes for them are not as great.
Public health and law enforcement, all working together to connect the dots and advocate collectively.
We also feel like an impact statement gives us a greater, clearer sense of what we want to achieve. Our impact statement was around the generational impact of social determinants of health on Black and Latino males in our community. But some of our initial data says to us that we need to address the needs of Black and Latino males across the lifespan. We have, again, we did this because we had some initial data from various needs assessments being conducted in our community, things that were not going well for males in the community, Black and Latino males, and hear from them, their voices.
Downtown Cincinnati, 13th and Walnut. I went to St. Francis School, and I've seen a lot of drug use, a lot of substance use, and so that just wanted me to just be better.
So we have in our community a number of coalitions for addressing various issues from suicide to the opioid epidemic.
The place that impacted me the most is downtown Main Street. My family were considered a bad group of people.
The place I would like to talk about today is the Center for Addiction Treatment, struggling with drug and alcohol addiction. Today, I'm a peer supporter there. I just recently got a promotion to case management outpatient services, and it helped me become a pillar in my community.
So Sue, why do you think people in Hamilton County feel it's important to address social determinants of health?
With health, we're not on a level playing field. There are people in this county who are really hurting, and they have food insecurity. They don't have access to health care like other people do. And we really need to work upstream, like we say a lot, with social determinants of health to make sure that they do have access. They do have their basic needs met. And that's very important.
Cuenta sus repeticiones y tiempo cuando corres. Está bien contar calorías, pero la mayoría no contamos nuestras bebidas. Hay poca información sobre cómo tomar decisiones informadas cuando eliges beber. Saber los tamaños estándar de las bebidas puede ayudar a reducir riesgos, pero pocos lo saben. Únete a Envision Partnerships para un curso virtual gratuito sobre cómo reducir riesgos y ganar hasta $125. Las pautas de consumo de alcohol de bajo riesgo pueden ser un gran paso hacia personas y comunidades más saludables. Regístrate hoy.
I'm Father Mike Puckey, a Butler County resident since 2005, a native Ohioan. During these years that I've been in Butler County, I've been there as pastor of St. Julie Villiard Parish. It's a very diverse group of people, diverse age-wise and language-wise and experience-wise and race-wise. Many of our parishioners are Spanish speakers who've been here for maybe some of them over 20 years. Folks who have, over these 20 plus years, made a real contribution to our Butler County community. And I've also, during my years working with them, become quite aware of the fact that many of them have experienced trauma. Folks that have been dealing with addictions, and particularly within the Hispanic community, my experience at least is that the principal substance that troubles our folks is alcohol. It's very typical of folks who are making this transition from one culture to another. So what I'd like to say is that I'm really thrilled that Governor DeWine on several occasions has talked about workforce development. And if it's true that we need more therapists, more counselors for the general population, it's even more true for folks who would be both language and culturally competent. So what is needed, I think, is a real effort to develop people and materials that are both linguistically and culturally competent. But if we find it difficult to find people who are linguistically competent, there's a lot that can be done for our workforce as it is today to help them become more culturally competent. Also, I'd like to see greater access for these folks, many of whom have lived here in Butler County and throughout the state of Ohio for 20 years or more, people who are part of the community as much as any of us, and especially because many of them have been working quite conscientiously on trying to normalize their legal status. Because we have so few culturally and linguistically competent folks that are able to work with our Hispanic population, I really want to emphasize as well the importance of prevention. So prevention in terms of alcohol abuse, but prevention in every sense of the word that we can certainly multiply our personnel. Because of that, I really would like to see a real effort to do some better recruitment of folks who are linguistically and culturally competent. That is the gold standard.
The work we've just seen was guided in part by the CDC resource titled Promoting Health Equity, a resource to help communities address social determinants of health, which describes how considering the impact of social determinants of health when planning for prevention services can improve health outcomes and promote health equity across the lifespan. Additionally, the Ohio University and PIRE teams provided training, technical assistance, professional development, and networking opportunities. The results represent a truly community-led initiative focused on actualizing the impact statements to work towards health equity in each community.
It's okay to clap because they're amazing. And you'll see a common theme is that when we work on diversity, equity, inclusion, and justice in Ohio, we do it through learning communities. We do it through networked opportunities for people to take a deep dive in materials and then put those materials into action. And we made it through the first two learning objectives. And now to bring us home, the final one is to learn a little bit about programs used to gain increased involvement and participation from populations who are at a higher risk for substance use and mental health disorders. There are 3 strategies for inclusion and voice that I'm going to talk about today, and the first one is involvement. In Ohio, through an initiative spearheaded by former state representative William Mallory, Ohio has the Urban Minority Alcoholism and Drug Abuse Outreach Program, or UMADOPS. Any UMADOPS represented in here today? Yes, thank you. This is a statewide network to address the needs of the African and Hispanic Americans across the continuum of care. In this particular project, we know that data drives decision making, and what we found is that in the communities that were predominantly African American or Hispanic, we did not have a lot of participation in Ohio's youth survey. Ohio's youth survey is voluntary because in Ohio, superintendents serve an elected board. And an elected board serves constituents, and so sometimes what constituents want or need is not exactly what the superintendent wants or needs, and so there's a huge need for communities to work together for this. So an idea was born to collaborate with the UMADOPS to increase participation in this youth survey, and you can see all of our UMADOPS represented in the tagline below. There were 247 schools that were engaged by the UMADOPS, and of that, 54 schools said yes. And that is amazing, 21%. Again, superintendents serve an elected board. This is a really hard sell. And the fact that relationships were built, and what we found is that the top reported success of the evaluation was the creation of new relationships and new contacts. Even if a school did not register, they were open to prevention programming, both during in-school and out-of-school time. So we look forward to seeing how this is going to increase participation in years to come as those relationships develop and move forward. And so let this be a lesson to you all who are trying to do surveys and collect data from schools. you're not expecting 100% yes all the time. You're expecting those small wins, right? And those small wins to gain those momentums for prevention programming. The second is adaptation. We know through the class standards that cultural and linguistic adaptations are necessary when implementing evidence-based prevention programs, policies, and practices. We also know that they alone won't erase the underlying cause of the disparity or inequity, so we have to keep that in mind. But it doesn't mean we should stop doing the programs, right? Because we need to do both. So I have the privilege of talking to you about Pause Before You Play, and again, we see all of the partners for there. We know that problem gambling through our survey is an issue in Ohio. We also know that Ohioans of Black or African American race and those with Hispanic ethnicity have a significantly higher rate of problem gambling. We also know that in Ohio, we turned on sports betting all at once at the same time, so everyone needed prevention. So an example of an adaptation, right, is to educate the public and educate everyone under a campaign that looks and feels the same, so people recognize, oh, that's the Pause Before You Play campaign, but I can see myself in it. And so when you visit the website, if you use the QR code, you will see that there is the Pause Before You Play in multiple languages for multiple populations, and you can click on the one that you need that's right for you. And then we have the Change the Game campaign, and that is specifically designed for youth. And so what you'll see is a wide variety of campaigns, but they're adapted because when you look at all these, can you tell they're all Pause Before You Play? Yes, 100%. You see that logo, you see it in different languages, and it's very accessible. So I will share with you one of our ads.
Hey folks, welcome to game day at Pause Before You Play. The betting's gonna be intense.
And we've got an all-star sports fan getting ready to bet. Dave, is he starting to bet on his phone?
No, Drew, that's his signature move, the pause.
Oh, he's setting limits on his betting.
Look at those fingers fly. No wonder he's at the top of his game.
If you bet on sports, pause before you play to set limits, recognize the risk, and know when to stop. Learn more at pausebeforeyouplay.org.
So when we look at our strategies for inclusion and voice, it starts with involvement. It also must include adaptation. The third strategy that we use in Ohio is media segmentation. And I have the privilege today of speaking about the Life is Better With You Here campaign. This campaign was created by the Black community for the Black community to address the issue of Black suicide. To be clear, in Ohio, we have multiple suicide prevention campaigns. We also felt that it was important to address this particular issue based upon our data. And again, multiple partners were involved with the Life is Better With You Here campaign. We know that the data was telling us that we need a specific and tailored campaign. And again, this isn't about taking away from someone to give someone else a campaign. What this is saying is we need to increase the pie and make sure that people can see themselves represented in a campaign and know that a campaign is made for them by them. So the project goals were to eliminate the stigma around suicide and mental health disorders in the Black community and also provide culturally appropriate support and resource. And then you see that theme of building bridges inside the Black community and creating safe spaces to talk about mental health. And of course, the overarching goal was to reduce and prevent Black suicide. So the Life is Better With You Here campaign is amazing. I was at Great America Ballpark this summer. That's where the Cincinnati Reds play. And you saw Life is Better With You Here in the stadium. And it was fantastic to see that. And here is an example of an ad that was by the BIPOC community for the BIPOC community.
That is the sound of a teen girl reaching out to you in the middle of a mental health crisis. Oftentimes, we miss the warning signs because we aren't paying attention. Teen suicides are plaguing the Black community. Awareness is key with suicide prevention. Learn more about warning signs at withyouhere.org.
You can clap for that. That's good. Thank you very much. And we see Life is Better with You. They have an amazing podcast where they have guests that discuss mental health and suicide in the Black community. And again, there's links when you go into our link tree. They have handouts that you can see on your far left, my far right. Ads on buses and bus stops and in places where folks will see those ads and will be able to use the content.
Don't you get up? Oh, goodness. Okay, whatever. But because you guys are in Ohio, how are you guys' partnership with a company in state SAMHSA with an initiative like this?
How are our partners with what?
Partnerships with a company in states. So states that's around you, like Michigan, things like that.
Mm-hmm.
In regards to this area, as far as this initiative of Life is Better with you.
Would you like to? I know that, so all of these are available to everyone, so you can go ahead and access those materials. I do know that Cincinnati borders Kentucky and is on northern Kentucky. We know that Prevention First, which is one of our large nonprofits that address substance use, has coalition work that they do actually in Indiana and Kentucky as well. So I would say there's nothing intentional, particularly at the state level with the single state authorities or departments of mental health and addiction services, but there's definitely locals in bordering states.
Okay.
Thank you for the question. So we made it. We made it through all 3 of our learning objectives. Thank you, God, for that. And as we close today, I was listening to a podcast. It was probably about a week ago, and the podcast interviewer was interviewing Suleika Jawad, and Suleika Jawad is John Baptiste's partner. And anybody here familiar with American Symphony and John Baptiste? Yes, he is amazing. And if you haven't checked out American Symphony on Netflix, I highly recommend this. And what it is a story about John Baptiste, who is an amazing musician and was nominated for 11 Grammy Awards and won 5. And his wife was an amazing writer, and she had a book on the New York Times bestseller list. And he was working on the American Symphony, and it was part of an initiative with Barack and Michelle Obama, and they were going to do a documentary of it. And as they were getting ready to film the documentary, Suleika's cancer returned, and she was in remission for 10 years. And when she was on this podcast, and she said, creativity is an act of survival. And what I want to leave with people is that if you start a project and end a project and you make no changes, you're doing it wrong because you're not listening. You're doing it wrong because you're not listening. And this DEI work here, you can clap for that, yes. And this DEIJ work in Ohio, it is done by partners, and you saw all the partners on all the slides, and it was my privilege here to represent the work here in Ohio, so thank you, Bobbie, for inviting me to do that. And these projects are messy, they are difficult, and they take a long time. And you know what? It's because we listen. And when you listen, the results and the outcomes are better because you give voice to many people in the process, and you allow the project to take a life of its own, and the results are there. So thank you so much for links to today's content. And to all of our partners who are in the room, and to each and every one of you, thank you for being here and for your commitment to behavioral health promotion. And I guess now is it time for questions.